Welcome to the Oncology Voice Network Podcast, connecting the voices that move oncology drug development forward.
Today we're exploring one of the most critical and often misunderstood roles in oncology, field medical, and its responsibility to bridge science, insight, and real-world clinical practice. As oncology becomes increasingly complex and data-driven, progress depends not only on generating evidence, but on how effectively that science is exchanged, interpreted, and applied in the field. Our guest today is a leader who helped elevate that role across the industry and a long-standing advocate for field medical excellence. She has spent years strengthening scientific exchange, mentorship, and collaboration within medical affairs. Today's conversation will explore the true purpose of field medical, where the role is often misunderstood, and how its voice can more powerfully shape oncology care. Robin, welcome to the show.
Well, thank you for having me.
It's such a pleasure to speak with you today. I mean, not only because of your vast experience in field medical, your leadership of MSL teams and MSL excellence, and leadership in MAP since the beginning year we founded the organization, but because also you are a co-author on the chapter of Voice of Field Medical in our book. But before we get into some questions, could you just first tell us about your history and path and how you got to where you are now?
Sure. A bit of a circuitous path, but all great. I was really following in my father's footsteps, who was a neurosurgeon, and he actually encouraged me to join the industry, which at the time was, who joins this industry? I figured I'd start and then, go back into a traditional practice the way he had. However, I learned that you really could affect a lot more people joining the pharmaceutical industry, and it's been a great opportunity. How I got to field medical was really largely falling into the role. I was in the traditional medical director, had the opportunity to run MedInfo, different areas in dermatology, things along those lines, some new product development. And then I was at Sandoz during the merger. This goes back to the dark ages. Sandoz and Ciba merged, and someone in the leadership team said to restart our field medical group with a group that has doctoral level scientific degree people, which was different than their original group, which was actually like the original MSL teams, but originally it was sales reps who then became the purveyors of scientific information in the institutions from a sales perspective. We then switched it over to, medical really needs to have that voice as well, although sales is certainly very important. Medical on a non-sales side, scientific, in-depth scientific exchange purview, decided we should start something like this at the new company, which was the combination of Ciba and Sandoz. From my standpoint, I had no idea how to start a team, and I had no idea even barely what field medical was going to be like, simply because most of it at that point was traditionally sales or people coming from the sales organization. However, realizing that it was really a critical role, I figured if I didn't do it, someone else would, and also figured I probably had a year before they figured out I didn't know what I was doing. And hopefully in that time period, I learned what really was needed in these types of groups, and had the great pleasure of also hiring some fabulous people that we all learned from. And then the team started from there. And as time has gone on, field medical has gone from a periphery type of group, as you've seen, I know in your time span within the organizations and your leadership, it's really gone to now being part of the whole fabric. Is how do you launch an effective product? How do you really, make sure that we understand what's going on the medical community level? So that was a long answer, but it really, was part of how the journey went from medical school to industry, and then discovering field medical, and then really getting involved early on. And it's been an incredible career. So I actually think it's one of the best jobs.
Maybe talk for just a minute about you were being introduced to something really new. And now with our industry, there's a lot new with AI, with different jobs, how you approach them. Maybe something to our people who are interested in your path, how you approach that. When you're approaching something new that maybe you may not know a lot about it, what's important as far as taking on those roles?
I think it's being willing to take a risk. I think it's having, honestly, faith in yourself that you will figure it out. I've also learned that those that bring you in want you to succeed because they want to succeed with you. And so there were a lot of wonderful people along the way and you're the king of a lot of this, or the foundation for a lot of this for organizations like MAPS, which you started, because I think at the end of the day, so much of it is your network. And I know you and I have personally talked about this a lot. So I have to say it's mentorship. It's people that have been experts that I've been able to turn to. It's people that I've had confidence in and have frankly had confidence in me, and people that you can ask the difficult questions to. So a lot of it is that community and that network. And I think that's one of the most important things I learned along the way. Don't be afraid to fail, but also ask questions, take chances, and really take time to listen and learn from others, because that's really where that great knowledge comes from.
So I feel as if one of my main roles in life is to keep Robin busy. As you said, you mentioned MAPS already. You've had a number of ascending leadership positions in MAPS and are still there. You also contributed a chapter in the MAPS textbook, which you wrote. And now the Voice of Oncology, both as far as OVN and Voices of Oncology book. What motivated you to contribute to the book and now the OVN podcast?
So all joking aside of the fear of Kirk, no, but in all seriousness, I think the world of you, and but it's really an honor. It is absolutely an honor to be asked to be involved. Over the years, one of the things that I've learned is I don't think there's anyone that is not touched by cancer on some level. And with all the things that the industry is doing in terms of research, there are more solutions now than there ever were. There are more attempts making improving outcomes, or at least improving the journey. You certainly can't cure everything. We never will be able to cure everything. But if we can make that journey better, if we can help people along the way, then that's really why I think all of us have gotten into medicine, and one of the main reasons getting involved with this organization, because it's not just oncology, it's also bringing in different experts that I can turn to, looking at your website, looking at what you're trying to build with Ramin, Rebecca, and that whole team, and really saying, is there a resource? And now there is, and looking for evidence-based information, which especially in this world these days, you don't know what to believe. And I want to go to a site where I know there are experts there that have experience that I can ask those questions to, personally and professionally.
When the readers finished your chapter, what was the one thing you most wanted them to understand about field medical?
Largely the way the field has evolved. There are people who throw the term MSL, field medical, out there and don't really truly understand that these are scientific experts that really spend a lot of time in as practitioners before they got into these roles, and that really are playing that critical role between the healthcare providers, the practitioners, and the places in the industry where they're working, whether it's in devices or the pharmaceutical, biopharmaceutical, and all the allied areas these days. It's really those in-depth scientific knowledge, field-based discussions that are so critical.
You mentioned yourself that you had been in other therapeutic areas besides oncology. Maybe just your opinion on, do you need to be an oncologist, have oncology training to be in oncology, whether it's field-based medical or medical affairs?
No, but you need the desire to learn. And I think having that clinical practice that you have certainly is the basis for, an immense knowledge. But I do think that people that are curious, that have a scientific background, can certainly learn, especially in these roles. You have to be willing to put the time in. You have to be willing to certainly be a continuous learner, because this is critical. As you mentioned before, things are always changing. It is very a dynamic environment. In order to talk with those leaders and those scholars, you need to at least be able to converse on an educated level and to be able to understand what's happening in this field. So much is exploding these days. And there's so many different facets. Remain curious and scientifically on that leading edge as much as you can. I think that's also the gift that the industry gives people, that when you're interested in these roles, given that opportunity, take advantage of it and keep studying and always keep learning and always listen and learn from others.
Good advice. And I have to say, some of my best people in field medical and medical affairs for that matter did not have formal training in oncology. They learned it. They had a desire to learn more about cancer. So I don't think it's a requirement, but as you say, it kind of gives you a head start if you have had that training. But again, I've seen a lot of successful people who have not had that formal training.
Sometimes people get intimidated by, well, I don't have that exact background. We all come with our own baggage. And if you've been a practitioner in oncology, or you're an oncologist, you're an oncologic surgeon, any of those areas, you come with your own mindset and your own experience. And sometimes that makes it harder to join some of these roles, especially because there's a big switch. You're not that expert, even if you were the key thought leader in the field. You're now joining the industry. You're still a thought leader, but you're working in a different type of role. You cannot give specific advice about patient management when you're working directly for a company. You can certainly give the information, which is what you're supposed to do, fair, balance, evidence-based, so that the practitioner can make the best decision possible. But you are switching roles, and it is a change.
Robin, as you know, one of the main themes of Voices of Oncology book is about collaboration. And by helping people to understand about each of the roles, hopefully we'll have increased collaboration in oncology to get cancer cures. Where do you most often see collaboration break down around field medical? And what critical insights tend to get lost as a result?
Communication. If I have to say one thing, we talked about this in the book, insights are critical to field medical. These are the people that are out there in the medical communities. They're hearing things. They're meeting with thought leaders, experts across the board in their area of specialization and bringing that information back. However, a lot of times, and insights, I must say, first, do come from many other areas as well. It is not just field medical. It comes in from commercial. It comes in from R&D. Comes in from, the medical directors in different venues and ways. So it does come in from lots of different places, although field medical does play a critical role in it. But a lot of times that information is not communicated. And when it's not communicated to other functional areas or appropriately, we do have a highly regulated industry. We do have to respect compliance issues, regulations, privacy, and so forth. However, in the right way of communicating, it is critical to make sure that these key themes, these trends, this information gets to those right people so appropriate decision-making can be made, which I've seen change commercial operations. I've seen it change research and development. I've seen it create research and development, as I'm sure you have many, many times, where a new idea comes in. And once you start seeing it possibly as a pattern that there's an issue that's gone on geographically, that it started in one place, and then you start hearing about it at another location, you start realizing maybe there's a pattern here. Maybe there's an educational opportunity. Maybe there's a signal we need to look at. Or maybe there's a new potential treatment that is worthy of looking into further that sometimes will lead into a new area of research. That's not just a cross-functional area, but also globally as well as locally.
So how does ineffective field medical engagement ultimately affect patients, particularly when there's a gap between the emerging science, which occurs very quickly with oncology, and real-world clinical practice?
Well, we have to look at access, for example, and with field medical, they are out there. So if the patients can't get into care, can't access care, you can have the best therapeutic agents, you could have the best healthcare providers, but the patients need to be able to have access. They need to obviously be knowledgeable about their treatment. And so it can certainly affect patients. If it's an educational issue, if it's an access issue, if it's a money issue, that affects all of us. Healthcare, especially in this country, but globally. That's something that field medical is also a voice for. They also work with patient advocacy groups. They really should, if they don't, they should have the pulse on what is going on with patients, what is going on with the medical community. Where are the challenges? Where are the opportunities? What are you hearing out there? And what can the industry behind them possibly do to help rectify that, to help make things better, or at least to recognize those challenges, those signals, those issues that may be going on? So it happens in all sorts of forms.
Despite progress, what continues to frustrate you about how field medical is positioned or utilized today?
Is making sure that they are heard, making sure that you have the right people in the field because, the some of the talent is changing, some of the need for understanding, technology is increasing rapidly, how we can utilize the new tools and AI and everything else, but also how the voice of these people, not just the practitioners, the MSLs themselves, field medical, which is actually a more accurate term because there are other people out there beyond just, MSL of people that are concentrating on preclinical and so on and so forth. However, their voices, if they are not brought in-house, if what they are saying, their insights, the other information they're bringing doesn't get heard within the organization, then that great information cannot be actioned upon because nobody's heard it. And so a lot of my role in leadership in particular, whether it's in excellence, in leading a team, or in allied functions, has been to really listen to what they're saying, bring the information in so that people have that information to make better decisions on. What's frustrating is in the field, you are out there working in your own office, traveling around. They are still, in many cases, traveling. The engagement has shifted many ways, especially after COVID, but the engagement is critical. But again, what they are doing needs to be talked about. And a lot of times I felt that I was their head cheerleader. I was the one that would say, let me tell you what's going on out there so that they're not out of sight, out of mind. Because one of the areas that's the most frustrating is you have highly talented people. Ask them. You have a question that's about solid tumors. Ask the people that have expertise in it. You've got MDs, PhDs, PharmDs out there that in nurses that have done all this research, have all this information. And a lot of times we look for outside experts, which is fine and appropriate. You have resident expertise, a lot of times sitting in field medical, that is not recognized or utilized to the extent that they could potentially be.
Let's talk about the future. How do you see the role of field medical evolving over the next decade in oncology or other therapeutic areas for that matter?
There's so much research in oncology going on, and it's such a critical area, as certainly other areas are as well. But it's really evolving. They are the purveyors of changing information. They are the purveyors of in-depth scientific exchange. And I keep getting back to that because although the venues may change, as we talk about a lot of times, the different channels people want to use, how do they want to communicate? Part of the expertise of field medical is not just that scientific knowledge. They've got to be able to impart that knowledge, but also they also have to be flexible. They have to be flexible, not just in listening and exchanging information, but how that information is applied, is utilized, and being able to deal with many different people in many different areas as well as different functions. And it's changing so rapidly. Look at our patients. Our patient population is becoming more educated, hopefully, and especially with the Oncology Voice Network, with other resources that are continuing to evolve to have this information available to them. They're going to have questions. And although field medical is not usually dealing directly with patients, they are dealing with those practitioners. The patients go to the practitioners. And, field medical needs to be in position to be able to answer those questions in the different ways that people may ask. It may be the venue that they're using. It may be the timing. Do they want everything always immediately? No, but they usually want it short, sweet, and to the point, and make sure that it's evidence-based, fair balance. And that's what field medical is really standing for. But also to be able to use technology. Patients are going to be using more and more ChatGPT and AI and all the newer things, as well as, having their own agents, which is going to be going out looking for your information, giving it to you, and being at your own personal service. But that also educates them and helps us individualize the treatment even further to not just the therapeutic agent to the disease state, but also to how the patients want to receive it and what's going to increase compliance and hopefully increase the outcome and improve it.
Well, Robin, let me ask you this. How could a shared cross-functional community like OVN help elevate the field medical's impact across the ecosystem?
I think it's really essential. From a compliance standpoint, there are certain firewalls in place. It's essential that we really have to depend on each other and the cross-functional knowledge that each of the areas has. For example, Commercial knows what's going on from their perspective. Research and development knows what's going on from their perspective. And field medical, especially as it's evolved as a specialty and so critical in medical affairs in general, they have their eyes and ears to the field, but they don't know everything. Nobody knows everything. And combined, all those different areas together are really what brings us a lot of strength and really helps us evolve the specialty of oncology, especially in an area that's evolving so quickly.
Right. Every listener now changed one habit. Well, I'll give you two if you want, but at least one habit tomorrow to better support field medical and scientific exchange. What should that be?
Communicate more effectively. And the second thing would be to tell the field what is going on and for them to listen to what field medical has to say. They don't have to agree all the time, certainly, but a lot of times patterns emerge. There's always that feeling of, I'm giving all this information, is it going into a black hole? But really learn from each other across the board, not just in field medical. Field medical is the eyes and ears of the healthcare community, of what's going on in the local environment, and all the patients that are represented. And again, oncology is changing so rapidly. All of the practice of medicine is. We really have to listen to what the healthcare providers are saying, what the challenges are, and what we can do as an industry, not just from increasing opportunities from a therapeutic standpoint, but overall access and overcoming challenges together.
Robin, you've had a lot of experience. You're in leadership positions now in medical affairs, field medical teams. What does it mean to you personally to use your voice now to change oncology and collaboration?
I think what's really changed over time is field medical. People have really begun to recognize it as the voice of the healthcare community. If there was one thing I could change is to continue to encourage people that this is an incredible role to go into, that you learn worldwide of what is really going on in the local medical communities, that the voice of the patients are also heard through their healthcare providers. And that is such an incredible area to be in. And for those that go into field medical, it is so amazing to be able to meet those people that we all learn from, those that are really driving change. And in order for change to happen, we also have to take part of it. Otherwise, change is not going to happen, and we go the way of the dinosaur. So we really want to increase healthcare awareness. We really want to listen to what's going on, look for improvements. And, this is why we're looking at AI and all these other things we've been talking about, to look at how do we get into more predictive modeling? How do we really target therapeutic agents to help those patients? We're not going to always improve outcomes, but hopefully we can improve that journey. And that's for all of us as patients too. I don't think there is anybody out there that oncology hasn't touched their lives.
Robin, that's a good way to end. And that's all we have time for today. But I want to thank you for your participation today in this very insightful podcast conversation. And I also want to thank you for your work and collaboration for both of your field medical team chapters in our MAPS Medical Affairs textbook and our recently launched book, Voices of Oncology. It's certainly clear to me why you have a prominent leadership position in MAPS, both as board member and serving as the president of MAPS Americas region. I look forward to seeing you at the next meeting.
Thank you, and for all of your innovative thinking and all that you're doing for all of us as patients as well. Thank you.
Thank you, Robin. That's it for this episode. I'm Dr. Kirk Shepard. Thanks for listening and for being a part of the conversation that's moving oncology forward.